Welcome back to Healthy Mentality. I'm glad you're here because today's topic is one that touches my life personally and touches the lives of millions of men around the world. Now, if you caught last week's episode, you know I had the privilege of speaking with Paul Amadeus Lane, also known as Paul on Wheels. It was a powerful conversation, and if you missed it, go back and check it out. It's worth your time. But today is a little different. Today, I'm not interviewing anyone, I'm the guest. And the reason is because I feel called to share my story, my journey with prostate cancer. Just a few weeks ago, someone close to me lost a family member to this disease. He was only 57 years old. Too young, far too young. By the time doctors found it, it was already stage 4 and it had already spread to his bones. And hearing that shook me. It got me to thinking about all the men out there walking around right now, completely unaware that something could be silently growing inside of them. When I shared the news with my circle about how this woman's family member passed away, the response was immediate. One woman called her son and told him, "You need to get tested now." Another said she was going to push her husband to finally schedule his screening. And here's the important detail. They were both Black families. Their sons and husbands were right around that 45-year-old mark where Black men should begin screening for prostate cancer. And that is critical. Now, I know that some men are thinking, I've heard all the comments, "I'm not doing that test. No doctor is sticking their finger up my butt." And listen, I get it. Nobody wants to go through that. But here's the truth. The digital rectal exam, or DRE, is no longer the standard screening tool. Today, the most common way to check for prostate cancer is with a simple blood test called the PSA test. And here's the kicker. Most insurance plans cover it for free. So let's take the stigma out of it. We're not talking about pain. We're not talking about embarrassment. We're talking about rolling up your sleeve and giving a vial of blood that could literally save your life. Before I go any further, Montel Jordan, the singer of This Is How We Do It, that 90s hit, announced last year that he had prostate cancer, and he went through the process of surgery to get his prostate removed, and he was doing relatively well. And he recently announced that his cancer had returned, which means that they didn't get it all out through the surgical method, and his PSA levels started to climb again. So now he has to go through the process of radiation. And he was recently on The Breakfast Club. Shout out to the Downsizing Diva for sending this to me. Let's check out what he had to say while on The Breakfast Club. Yeah, so some powerful stuff there, and he's dropping knowledge. Um, so I would take heed. So what exactly is a PSA? It stands for prostate specific antigen. It's a protein that's made in your prostate. Every man has some PSA in their blood, but when levels start rising, that's when doctors pay attention. A PSA level of 4 or lower is usually considered normal. Anything above 4 means something might be going on. That doesn't mean cancer for sure. It could be that you're having a large prostate, you have a urinary tract infection, you've had sex within the last 24 hours. It's just a signal. There's also something called free PSA test. This measures how much of the PSA is floating freely in your blood versus how much is bound to other proteins. Why does that matter? Because blood cancers tend to produce more bound PSA. So if your free PSA percentage is above 25%, that's usually a good sign. If it's below 15%, doctors get concerned and might recommend further testing like an MRI or biopsy. So let's step back and look at the bigger picture. Here are some of the facts every man should know. Prostate cancer is the most common non-skin cancer in men. In the United States alone, about 313,000 men will be diagnosed in 2025. That's a 1 in 8 lifetime risk for men. The risk goes up sharply at age 50. Lifestyle matters. Being overweight, eating a poor diet, and not exercising can increase your risk. And that is one of the reasons when I was diagnosed, I was wondering if I did it to myself because I was insulin resistant, I was morbidly obese, I had metabolic syndrome, and it can contribute to getting prostate cancer. So I was down on myself, kicking myself and blaming myself for my diagnosis. So screening should begin at 50 for average risk men, at 45 if you're in the high risk category. And that high risk category includes Black men and men with a family history of prostate cancer. And it should start at 40 if you've had multiple close relatives that have been affected by prostate cancer. Now, let's talk about Black men specifically. Black men are about 80% more likely to get prostate cancer than white men. We often get it at a younger age. We're twice as likely to die from the disease. And part of that reason is because we aren't getting checked early. And by the time that we do get checked, it has already spread to other parts of the body, into your bones, and into your organs. And at that point, it could be too late. And also, when we get it, it tends to be more aggressive and more likely to spread. But here's the hopeful part. As Montel pointed out, once you catch it early, the success rate for recovery is damn near 100%. The problem isn't that it can't be treated. The problem is that too many men aren't getting screened until it is too late. Now, let's bring it closer to home and talk about my situation. In May of 2024, I went in for a routine appointment with my primary care provider. I was 49 at the time, just a few weeks from turning 50. She ordered a PSA test. I hadn't heard of it. I had no discussions about what a PSA test was. And honestly, I hadn't had any discussions about getting a prostate exam. It's not something that had been discussed in my family. It's not something that had been discussed within my friend group. It's just not something that was talked about. So it's not something that even you're aware that you should be getting. You have this impression that it is an old man's disease, and it clearly is not. And honestly, that the decision by that provider likely saved my life, because I probably wouldn't have gotten tested until it was too late and I had some kind of symptoms going on where they had to test me. And my decision prior to that to go to that particular provider probably contributed to that life-saving PSA test order. Being a Black man, I know that I have specific care needs. There are conditions that specifically affect my community and specifically affect Black men. And I sought out a provider for that particular situation. I sought out a provider that was a woman, because my experience with men is indifference. I sought out a young provider because I wanted someone that wasn't so ingrained into this is how we've always done things that they couldn't think outside of the box or couldn't have conversations and discussions with me about my care. And I sought out a woman of color. So my results came back. And as I mentioned, anything above 4 could be cause for alarm. My results came back. My total PSA was 7.4, so well above the 4 cutoff. And my free PSA amount was at 7%. Now, according to the lab work that came back, and to put this in perspective, anything below 10 means there's a greater than 50% chance of having cancer. So I sat down with my provider, and her initial recommendation was to wait 6 months and do a retest. But as I looked at those numbers and the likelihood that I could have had cancer, I knew I wasn't waiting. That wasn't an option for me. This is where advocating for yourself comes in, because I didn't like her. Although I was thankful that she ordered the test, I didn't like that she wanted to wait 6 months to do another retest to see how things would change. And thankfully, I have medical insurance that allows me to self-refer. I don't have to depend on a doctor to refer me to a specialist. And so doctors are human, and guidelines are sometimes cautious, but your body is yours. If something doesn't feel right, push for answers. So I referred myself to a urologist, and from there, the process accelerated. First, they ran an ISO PSA blood test, which is a more advanced test for detecting aggressive cancers. My score was 26.2, and anything above 10 is cause for concern. Next, I had an MRI, which showed a 7 millimeter lesion on my prostate with a PIRAD score of 4. That means a high likelihood of significant cancer. Finally, because of those results, I was scheduled for a biopsy. Now, let me prepare you. A prostate biopsy is not fun. They take 12 samples guided by an ultrasound through the rectal wall. It's invasive, yes, but it is the only way to confirm a diagnosis for prostate cancer. And my results came back. I had 10 of my 12 samples come back as cancerous. That's almost my entire prostate. It was almost completely covered in cancerous cells. Now imagine carrying that weight, knowing cancer is inside of you, not knowing if it spread, not knowing what your future looked like. Questions flood your mind. Has it metastasized? How much time do I have? Will I lose sexual function? Did my weight, my diet, my lifestyle cause this? And as men, we don't always talk about these fears out loud. We keep them bottled up because we don't want to worry our families, but those emotions are real. That's why having conversations like this out in the open is so important. Now, once diagnosed, treatment usually comes down to three options. Active surveillance, basically it's a watch and wait approach. This is more common if your cancer is small, slow growing, and low risk. It just basically consists of um, taking frequent PSA tests to see where your PSA levels are. And if something changes, then action needs to be taken. Next option is surgery, removal of the prostate, known as a prostatectomy. And then radiation therapy, targeting and killing the cancer cells without removing the prostate. And sometimes they also combine that with hormone therapy. For me, with how much cancer was in my prostate, active surveillance was off the table. It came down to surgery or radiation. And here's how I made my decision. I met with the surgeon, and the surgeon told me straight up, you are going to have erectile dysfunction. There is no if, ands, or buts around it. And he said the only question is what level of ED you'll have. You can get around it through pills or injections, and at that point, the depression sets in, and you're wondering how, why. And I just left that appointment, that consultation, just feeling low. And I was looking forward to the appointment with the oncologist. And the oncologist set my mind at ease. She basically broke it down like this to me. Both surgery and radiation have similar success rates, almost identical. Both carry risks of side effects, including incontinence and erectile dysfunction. But surgery almost guaranteed erectile dysfunction, while with radiation, those risks and those side effects tend to show up later. So what she said to me is, so if you get ED, it may be something, it most likely would be something later in life. So instead of getting it when you're 75, you may see it show up at 70. So I was like, okay, I'm rocking with that. This is the path I want to take. So for me, quality of life mattered. I didn't want to risk the nerve damage from the surgery. So I chose radiation. Radiation treatment was 9 weeks, Monday through Friday, 45 sessions. Before starting, there are multiple appointments to get you prepared for the radiation therapy. There is one session where they do measurements of your body. They do a scan to identify where to place the machine during radiation. They put small tattoos on both hips to line the machine up. You go back in and they insert these little metal rods into the prostate. These are called metal markers, and that just helps them make sure that they are targeting the prostate precisely. And then there is what is called spacer, which is inserted in between the rectal wall and the prostate to protect your bowels, to make sure that the radiation is not burning your bowels. So each session lasted only about 5 to 7 minutes, but you're there for about an hour. The hardest part wasn't the machine. It was managing my bladder and bowels. Your bladder has to be full enough to push your intestines out of the way. but not too full as well, and your bowels have to be empty. The daily balancing act was tough. Side effects, I only had fatigue and constipation and weaker urine flow. And they gave me Flomax the for the weaker flow, and that helped. I also had to resort to magnesium citrate on top of Marilax and Mag 07 that I was using as part of my GLP-1 regimen. But overall, I got through it all. So here's the bottom line. Prostate cancer is beatable if you catch it early. Don't let fear, pride, or misinformation stop you from getting tested. If you're a man over 50, talk to your doctor. If you're a black man or have family history, start earlier at 40 or 45. This disease took the life of someone close to my circle at just 57 years old. It could have taken mine if I hadn't gotten screened. To my brothers, advocate for yourselves. Wives and sisters, daughters, mothers, encourage the men in your life to get tested. This is healthy mentality. These conversations aren't always easy, but they're necessary. If this video helped you, share it with someone who needs to hear it, and don't forget to subscribe because we're just getting started.